I'd like in this short lecture give you a rundown about describing surgery called a urostomy surgery or ileal conduit surgery. I'd like to tell you what's really important to know before you have an operation. And I'll give you an overview of once you've had a surgery, a urostomy surgery or ileal conduit surgery. That's a surgery where the urine comes out of the body through an opening on the abdomen or lower stomach. What kind of medical products or pouching equipment will you be using? What are your options out there? There's a lot of options, and I'm here to help demystify and clarify some of these. And last we'll look at if you do have this surgery, a urostomy surgery, what can you expect after surgery? How's your life going to be, and what are the potential complications of it? Next slide, please. There's two surgical options for people who have bladder cancer that requires removal of the bladder. Dr. Kassouf went through both surgeries very briefly. The first one is the radical cystectomy and ileal conduit, also known as a urostomy surgery, and that is where the bladder is removed and a part of the intestine is used to make an opening on the abdomen so the urine actually will come out through this opening. And one in this case would require a pouching system or to collect the urine. This is the surgery and the procedure that I will talk about in this lecture. There is a second type of surgery, Dr. Kassouf mentioned it, a radical cystectomy with a neobladder or a Studer operation, and that's where the internal bladder is made. In other words, urine does not leave the body through an opening on the abdomen. Urine leaves the body through the urethra. I will not talk about this surgery, but I want to mention one important point about it. And if you can, next slide, please. So this is a picture similar to Dr. Kassouf had used. On the left is the normal kidneys and the bladder. This is before surgery on the left. And on the right, you'll see that once the bladder is removed, well, how does the urine get outside? Where does the urine go? Well, in the ileal conduit or urostomy surgery, the surgeon takes a small piece of intestine. You have about 20 feet long, a small intestine, so he just takes a little piece. It doesn't affect the way you eat or absorb food. And he makes an outlet. So he attaches the two ureters onto this small piece of intestine, and then one small piece of the intestine stays inside, and he brings the other end out and sews it to the skin, and that's the external outlet. That's where the urine will come outside of the body. Next, please. Before surgery, if you're going to go for surgery, it's very, very crucial that you get information from your healthcare professional, whether it's your urological surgeon, your physician, your urology nurse, or something called an enterostomal therapy nurse. And that's my background. I'm an enterostomal therapy nurse. That's a nurse that specializes in working with people who have ostomy surgery or also who have wounds. Today I'll just concentrate on the ostomy. Information for these surgeries is readily available from nurses or healthcare professionals. It's also available on the internet. There's a lot of information out on the internet. One word of caution, there are some internet sites which have information that is not reliable and misleading. So always refer to your healthcare professional or a website that is known to have good and reliable information. You can find that information on the internet and also in various brochures. If you're going for a surgery, an ileal conduit or urostomy surgery, it's really important for you to see what does the equipment look like. What does a pouching system look like? Because the time to look at the equipment and the pouches available is before surgery and not after surgery. When you're groggy, when you're waking up and looking at your stomach going, what's this? I've never seen that before. That's not the time to first look at this type of equipment. What's really crucial is if you're going for this surgery, or even if you're going for a new neobladder where the bladder's inside and you're not likely to have the urostomy surgery, it's still important that someone actually look at your abdomen when you're lying, sitting, and standing, and marks the best place for the surgeon. When I worked at McGill with Dr. Kassouf would send me all people who were going for a urostomy surgery or for a neobladder surgery. Because if you were going for a neobladder surgery, there may be a small chance that the neobladder can't be done, and the surgeon during the operation may have to make the urostomy surgery. So Dr. Kassouf would make sure that every single patient of his came to see either myself or my former partners at McGill, so that I would spend time with the person and their family, sit down, and I was able to answer and give information about lifestyle choices. What does a pouching system look like? You know, what's a pouching system all about? And then lastly, together, I would help determine where the best place for that pouching system to go, that little part of the intestine we call urostomy. So stoma site marking, or marking the site where the urostomy may go, is very, very important, and that absolutely needs to be done before surgery. Critical. That's not something that you wait to do once you're lying flat in the operating room, and I'm going to show you why. Next, please. This is an example of one of my former patients who came to see me, and this gentleman here, a young man, loved to wear tight jeans and wear them low down, and he had bladder cancer, and he had been told that he needed a urostomy surgery. So he came into my office, we talked about a whole bunch of things. I listened to his story, and then after the questions were done, we said, well, it's time to do the marking. And so what I did was, I had this gentleman lie down, sit up, stand up. He worked out a lot, and he worked in his garden, so he's always bending over. So I made him bend over while I looked at his abdomen. And here is what I did. I made some marks on the abdomen, and I avoided the skin folds. You can see here, there's two fairly deep skin folds. I don't want Dr. Kassouf or a urologist surgery to put the part of the intestine in the fold, because if it's in the fold, there's more chance of urine leaking when the pouching system is on. Why? Because if you put something flat on an area that has deep, deep creases, and if the intestine is here, urine's coming out, you increase your chance of leakage. So it's being proactive. It's trying to avoid problems in the future. Stoma site marking, very important. And we used to make sure at the end, tell our patients, you know, don't erase them, don't put more, because you're going to confuse the surgeon. Very important. Next, please. So what is an ileocondyly, or what does a urostomy look like? On the left, you see an actual picture. This is someone's lower stomach, and that's the belly button, or the umbilicus. And just on the lower right side is what we call a urostomy. And that's a part of the intestine that is non-sterile. It's actually, the doctor will bring the intestine through a small opening. It's an opening separate from the middle cut. And when the doctor brings up the intestine, he turtlenecks it. So what you're seeing is the intestine has been actually turtlenecked on itself, like a turtleneck collar, and then the surgeon will sew the part of the intestine to the skin. So the urostomy, which is what we call this part of the intestine, does not fall back in. And it's not sterile, and urine will come out of the urostomy, and one does not have any control. So it's very important that a pouching system stay in place to collect the urine. And the pouching systems, which I have some samples of different companies, I have them, feel free to come up after, and I can show you them. These pouching systems are meant to hold urine and are fairly leak-proof and odor-proof. So for example, one could be wearing a pouching system, and I'll show you some pictures, and you can do anything you want. You can go scuba diving, you can go on an airplane, you can go in a hot tub, you can go in a jacuzzi, you can go in the shower, and you can go to the restaurant, and you shouldn't have any kind of urine leaking out. The only difference is you're going to have to remember when, you know, that every couple of hours you may have to empty that pouch because you don't have any feeling. You may feel the pouch getting heavier as it fills with urine, but you have to remember you've got to empty it. And the key is keeping the skin around the urostomy healthy. That's the whole key to making sure the pouching systems stay in place. Essentially, you want the skin around the urostomy to look the same as the skin on the other side. You shouldn't have redness or skin breakdown. Next, please. So what are pouching systems all about? Well, the urostomy, there's a picture on the left, and you see the part of the intestine coming out. It's not sterile. And actually, to clean the skin, once you remove the pouching system, simply is done with warm water and a face cloth or other soft agent to clean the skin. You don't need any harsh detergents, and you don't have to disinfect the area. The key is that these pouching systems have to be changed on a regular basis. They're disposable for the most part. And there's been big changes in the quality and availability and types of pouching systems now on the market. Years ago, there were large plastic reusable systems, but now they are disposable and much more reliable. So on the left, you'll see that the intestine is sticking out. The person is cleaning the skin, drying it really well, and then they're taking their pouching system and cutting an opening. Basically, you want to cut the opening just a slight bit larger, 1/8 of an inch larger than the size of the stoma. Cut the opening, and you take off the backing. It's like a bandage. And while you're sitting or standing, preferably replace or stick the pouching system onto your skin. And once that's done, the urine will go into the pouch, and you can see here there's different pouches. Some pouches have knobs or twists, some have plugs, but they're all the same. They contain the urine, and when the pouch fills up to 1/3 to 1/2 full, it's time to empty. They're waterproof, leak-proof, and there's hundreds of different models available. Some are see-through, in other words, transparent, and others have a very comfortable cotton layer on it. So you don't have to see the urine if you don't want to. Lots of choices out there. Some systems, there's 2 parts, or 1-part, 2-part system is there's something called a barrier or a flange and a pouch. And so what you do is you put the barrier on first, and then you clip the pouch on. That's a 2-piece system. Or you can get a 1-piece system. It includes the sticky part, the flange, stuck onto the pouch. Very easy to change. It takes about a couple of minutes. But it's important to know they're leak-proof, they're waterproof, and you should never have any leakage or spillage. Next, please. What are the complications of having a urostomy? Well, the biggest complication is at the top here, that if urine leaks under the barrier or the flange and stays in contact with skin, it will start to irritate or break down the skin. And once the skin gets reddish or starts to break down, think of it, it gets harder to put a sticky adhesive on that area. Think of your finger. If you cut your finger and the finger's all wet, try putting a bandage on. Is it going to stick? Not really well. So the more the skin breaks down, the harder it is to keep these pouching systems on. So if redness is noted without skin irritation, it's often a sign that urine is leaking. And really, the way to address that situation is to make sure that you're cutting the opening or choosing the opening to the proper size, and that you're not leaving any skin exposed, because the urine will quickly break down and irritate the skin. Once the skin is broken and there's moisture coming out of that area, one can use certain things like powder. There's actually a powder, and I have some sample to show you. And what one would do is sprinkle a little powder on the broken skin, take off the excess, and then replace the pouching system. And the powder is dry, so it creates a dry surface, and the system can actually stick to it. But think of it, if you use a cream, put a cream on, put your pouching system on, what's going to happen? That pouching system isn't really going to hold well. You're going to get more leakage, more redness, more skin breakdown, and it's an endless cycle. Sometimes the stoma, the urostomy, will actually go inside more and more, and that's a bit of a problem, because the less a stoma is sticking out, the greater chances are of leakage, and you can get more pouching systems to address this. There's also hernia, where there's a bulging outward of the intestine. There's a bulge that forms around the urostomy. If you start seeing anything different, you're best to go to see either your urologist or ideally your nurse specialist, which is an enterostomal therapy nurse, and that's my background. Enterostomal therapy nurses are trained to work with people with an ostomy surgery and to help you address address any of these skin problems. Again, if you have any questions, I'm available after. It'll be a pleasure to answer any questions after your surgery, after the discussion here. Thank you.
What do you think the osteotomy?
I'm sorry, you want to talk about
In the osteotomy, you take care not sterile. How you protect the bacteria to not come inside to the ureters to cause infection?
It's an excellent question. To avoid, if I understand your question correctly, getting a bacteria or an infection into the urine system through the urostomy, it's a matter of just good hand washing before. So wash your hands very carefully before you change your appliance or the pouching system, and don't reuse your pouching system. Try to keep the pouching system on for between 3 to 7 days. And when you remove the pouching system, wash your hands also.